அப்புறமா சுரேந்தர் சார் கொடுத்துருங்க. சுரேந்தர் சார் வில் டேக் த ஃபர்ஸ்ட் செஷன். ஆஃப்டர்வர்ட்ஸ் யூ வில் டேக். ஓகே, தேங்க்யூ.
Good evening, everybody, and welcoming all to our today evening's program. Today, Surendra sir will guide us today. Mr. Surendra sir, please continue the session. Yeah, thank you.
Good afternoon and evening to village members. I don't know, election has not come to the north quickly. Why our people are not joining our? It's only in Tamil Nadu it's very vigorous.
Yeah.
Okay, so in the game. Today I'll take one subject and then I'll go to pain management last chapter. Okay. You used to see, always I used to go for articles on Sattaloka where health related things are described. This issue had a fascinating article on fasting. Not only fasting the right way. They said that Mahatma Gandhi also observed fasting. He's a great man, observed fasting. And you see, Jain community, they undergo fasting for 1 week, 10 days, 15 days, 30 days like that. Mormon community, they undergo fasting. This is the fasting month for them, Ramzan. They don't take anything in the morning, but they take food in the after the sunset. What are the spiritual benefits of fasting? Fasting means staying away from food. That is not the thing. That is, mind should reside near God. That is the thing. The concept of fasting is whatever religion you do. And in Hindu mythology, we call it a Ekadashi, that is the 11th day, either after the full moon or after the new moon. We observe Ekadashi, 11th day. And that is considered to be a very good day for fasting. If you cultivate that, it may seem to be some physical exercise, but it requires good control over the mind and can consider mental and spiritual exercise, leading to improved mental skill and brain functioning youthfully. For spiritual seekers, they communicate with the Almighty. First, not only they undergo fast, they do bhajans and other things. Fasting helps exercise control of the mind, and fasting keeps distractions at bay. And the Ayurvedic benefits of fasting are stomach and intestine, the indigestion, which causes laziness in the body, it makes them normal. According to Ayurveda, fasting boosts sattvic nature of the mind, pitta dosha, which is related to enthusiasm, intelligence, analytical ability of mind, etc. At the same time, we get physical strength along with vata pitta imbalance. So we become normal after the fasting. We feel very agile and light. In the case of controlled fasting, mechanism by which the body recycles old and dead cells is activated. This is clinically proven. Additional energy is extracted from the cells to the body. You know, when we are fasting, we don't take any food or liquid. Some can take little hot water if they want. Fasting is of many types. Taking food in the morning, early morning, and no food till the night. That's one. Fasting from the morning and taking foods and other things in the night is another one. It all depends upon the age and physical factor of the person. Some who don't take anything right from the 6 o'clock till night, they may take some little hot water, lukewarm water. Because you see, sometimes the bile juices, the acids in the stomach, they may cause disturbance. For the first beginners or persons who begin to practice continuously for some weeks, they have to come in the groove. Sir, why you are telling us this? What way it is beneficial? Ayurveda recommends fasting for just a day in a fasting. Body toxins are cleansed. You don't take smoking or drinking on that day. You see, why many of the people go to Sabarimala? You see, because they control all these devices, smoking, drinking, taking non-vegetarian food, avoiding activities, etc. So that gives them immense vitality in the body. On the night before the day of fasting, one should have sufficient food with moderate salt and spice. It is good to get up early in the morning, have a head bath, prayer and pranayama, and strengthen one's resolve. That is, you must concentrate your mind. Exposure to sun or wind can increase vata and pitta, so avoid that. Physical constitution, occupation, and the
Sir,
dopa
சொல்லுங்க.
factors are
எந்த
controlled.
லாங்காக இருக்கலாம்.
Skipping the breakfast long as possible is a type of fasting. In modern times, some undertake fasting with the intake of only 2 chocolates, an ideal fast for gastritis, and then intake just vegetables. A combination of the above methods can also be tried. Keep an eye on undesirable effects of fasting. Adjust your diet according during any fasting schedule. Observe the sign of and stopping the fasting regime is more important than following the stringent and rigidity fixed on the fasting. That is, you must not have a very fast and hard and fast rule. Alright? You must observe some easy methods.
అదేదా
Like I said, lukewarm water or taking some vegetables, etc. Ayurveda says, Ajirna Bhojana Visham. That is, the food you have taken is not digested. You are not getting hungry. You should not take dinner. Whatever you take turns to Visham. Visham. Poison. Till the previous food is digested, you should not trouble your body. That is why they say 4 hours to 5 hours. Particularly elderly people like us, above 60s, 70s, 80s, you must take little quantity. You must have a picture quantity. Whether you are a diabetic or hypertensive patient, you must always have fasting habits or diet habit regularly. Ati sarvatra varjayate. Anything consumed in excess just because it makes you feel good. See, I like
ಇಲ್ಲ ಈಗ ಕ್ಯಾಲ್ಕುಲೇಷನ್ ಕರೆಕ್ಟ್ ಆಗಿದೆ ಅವ್ನು ಮುದ್ದೆಯ ಕೊಡ್ತಾರೆ ನಾವು ಚಿಮ್ಮ ಇದು ಮಾಡಿ ಬನ್ನಿ
or lassi. I cannot take more. For everything there's a quantity. If you take badam halwa because you like it, it will end in dysentery. Like that, you take any sweets, any other liking foods, it must have a limited quantity, particularly for elders. You should not take fried item. Take 1 or 2 pieces.
ಈಗ ಕೊಟ್ಟ ಕ್ಯಾಲ್ಕುಲೇಷನ್
Sometimes you can do one more thing. You chew it and throw it. Don't swallow it. That's also a good habit. Because you see, your body doesn't work. So elderly people must have very, very careful approach with regard to their diet and disease.
పోదు మొదలు అది
Not
తెలుసు
that
తెలుసు
you have been operated or you have been undergoing some chronic diseases or your diet and treatment at fixed, etc., etc. You must also have your own chart. Of course, your family members may take more. You take little. You take little. Don't compete with them. You must have proper sleeping. If the sleeping habit is not there, there will be indigestion, there will be malnutrition, there will be other problems, there will be constipation, like that all other things will come. It is called Ardha Roga means half disease, etc. So, our elders have fixed everything into a definite proportion. They have made you understand what you should do, what you should not do. Yes. Yes, of course, I took a lengthy lecture on that. I wanted to finish it. And it is not to bore you, but you see, I may like something. People bring them, particularly French noodles, French fry. Somebody likes it. It is soft. Say, what kind of soft? It can get easily digested. No, you cannot take it at a time. Pani puri in a whole of India, you know, the Pani Puri is an evening recipe. So you cannot take Pani Puri 50, 60 like that. For everything, there's a limitation. You see, it disturbs the stomach acid. Disturbs the stomach acid. So that's how we are all going on. Okay. I want to take the pain management of limbs and joint pain. It will take another half an hour. I don't want to trouble you now. Because my friend Anup will fight with me. Sir, what about my quota? It's all in the game. So everybody wants to share and exchange our maximum things to elite group so that your benefit, you maintain your health. Wherever you see, we wish them good health. You may be a billionaire or millionaire. It's not going to help you. What happened to S.P. Balan, the music singer? What happened to this Vasant and Company owner? They're all billionaires. They caught in the COVID. They could not maintain their health. Everything gone. Health is important. Health is important. You may ask me and tell me, sir, what is it? What is there in you living for 100 years? What is there in without depending on somebody? Yes. What I say is, you live your way in such a way not to depend upon others, except for some help. You must be able to walk yourself, do your work, take your food, like that. You maintain that. You don't disturb your family. For that, the health
మీరు
is,
పెట్టేసుకో లోపల.
that is the concept of health. Health and means not taking medicine and just sitting in the chair and commanding things. No. You must be able to do your work. You must have good sleep. You must walk, even at 90 years. That's a God's gift. With your exercise, with your habits. So, thank you. I'll hand it over to Anu. I'll take up the pain management, limbs and bones next. Thank you.
Thank you, sir. Thank you, sir. Today I will just brush up the adrenal glands for you all to just to we go through the adrenal gland and see what's the use of it and how does it affect our health. Slide is visible, sir, for you all?
Yes, sir. Yes, sir.
Okay, thank you. So adrenal glands, it's by the name itself, adrenal means it is connected to the renal, the kidneys. So it is on the top of each kidneys, and that is why it's not a part of kidney, but it is sitting on the kidney, so it's called adrenal gland. Adrenal is known as the suprarenal gland. Suprarenal means on top of the kidney, and it is an endocrine gland. Endocrine gland means the gland which is secreting the enzymes or hormones, whatever it produces, directly into the blood without any sort of duct. So ductless glands are called endocrine glands, and this produces a variety of hormones, including adrenaline and steroid hormones. So aldosterone and cortisol. These two items are the steroid hormones. They are found above the kidneys and hence called adrenal. Each gland has an outer cortex which produces a steroid hormone and the inner medulla. The adrenal cortex itself is divided into three zones: the zona glomerulosa, zona fasciculata, and zona reticularis. So this is the picture of the adrenal. It is looking like the kidney is wearing a cap for its birthday party, like there's a kidney cap. That is called the adrenal gland, and it is yellow in color. Kidney is having this dark chocolate color. It's yellow colored gland on top of the kidneys. The adrenal cortex produces the main type of steroid hormones, mineral corticoids, glucocorticoids, and androgen. Androgen is important for males. The mineral corticosteroid is an adenosterone. It is produced in the zona glomerulosa. This helps in the regulation of the blood pressure and electrolyte balance. So if there is any problem, the blood pressure changes and the electrolyte balance also changes. The glucocorticoids and cortisols and cortisones are synthesized in the zona fasciculata, and their function include regulation of metabolism and immune system suppression. The innermost layer of the cortex, the zona reticularis, produces androgens, and that is converted fully into sexual hormones in the gonads and other target organs. So androgens are important sexual hormones, raw materials. So medulla produces the catecholamines, which function is to produce rapid response throughout the body in stress situation. So when there is a stress situation and there is an emergency for you to do something, this is the hormone which is making it work. If the adrenal glands malfunctions, there will be a number of endocrine diseases. Overproduction of cortisols lead to Cushing syndrome, whereas insufficient production of associated with Addison disease. So the two diseases are there. More will lead to Cushing syndrome. Insufficient production will lead to Addison's disease. The congenital adrenal hyperplasia is a genetic disease produced by the dysregulation of endocrine hormone, controls mechanism. So the endocrine control mechanism is dislocated by this adrenal hyperplasia. A variety of tumors can arise from the adrenal tissue and are commonly found during some medical scanning for some other disease. So normally it is not seen. So when you do scanning, maybe you will locate some additional tumors on the adrenal gland, and then you have to start working on it. The structure of the adrenal gland. The adrenal gland is located on both sides of the body, on the retroperitoneum. The retroperitoneum is the outer skin of the kidneys, and about slightly medial on the kidneys. On side, in the middle part and slightly sideways, it is located on each kidneys. In humans, the right adrenal is pyramidal in shape, whereas the left is semilunar. So there are two shapes for this also. The left one is pyramidal in shape, and the right one is semilunar, or like a crescent shape, somewhat larger also. The adrenal gland measures approximately 3 centimeters in width and 5 centimeters in length, and up to 1 centimeter in thickness. Their combined weight in adult human ranges from 7 to 10 grams. The gland is yellowish in color. The adrenal gland is surrounded by a fatty capsule and lie within the renal fascia, which also surrounds the kidney. The fascia surrounds the kidneys. The weak septum, or a wall of connective tissue, separates the gland from the kidneys. The adrenal gland is directly below the diaphragm and are attached to the pleura of the diaphragm by the renal fascia. So renal fascia attaches this on the underside of the diaphragm. Each adrenal gland has two distinct parts: the adrenal cortex and the inner medulla. Adrenal cortex. The adrenal cortex is almost its outermost layer of the adrenal gland. With the cortex, within the cortex, 3 layers are there called zones, which, when viewed under the microscope, each layer has distinct appearance. Each has different function also. The adrenal cortex is devoted to the production of hormones, namely aldosterone, cortisols, and androgens. Zona glomerulosa, the outermost zone of the adrenal cortex, is is the zona glomerulosa. It lies immediately under the fibrous capsule of the gland. The cells in this layer is oval, layers form oval groups separated by thin strands of connective tissue from the fibrous tissue capsule of the gland and carries wide capillaries. This layer is the main collection of aldosterone and mineral corticoids. By the action of the enzymes aldosterone synthase, the corticoids are produced. The aldosterones play an important part in the long-term regulation of blood pressure. So this is the factor when there is a blood pressure changes. This aldosterone plays the role in that to maintain and balance. Zona fasciculata. The zona fasciculata is situated between the zona glomerulosa and zona reticularis. The cells in this layer are responsible for production of glucocorticoids, such as cortisol. It is the largest of the three layers, accounting for 80% of the volume of the cortex. Zona reticularis is the innermost cortical layer of the zona reticularis, lies directly adjacent to the medulla. It produces androgens, mainly dihydropane androsterone, DHEA, and DHEA sulfate. The androsteroidion, the precursor to testosterone in humans. So it's a sexual enzyme or hormone precursor. That is, after that it will turn into testosterone. So these are the pictures of the different types of cell layers on the three layers of the stone. Sonia has this like capillaries, and others have circular tubular like that on both sides. This is the capsule. So this is the cell pictures of that, and this is how the gland on a cross section in this slide, and the position and placement of the gland is already discussed. So medulla or adrenal medulla. Adrenal medulla is the center of the each adrenal gland and is surrounded by the adrenal cortex. The chromatin cells of the medulla are the body's main source of catecholamines, adrenaline and noradrenaline released by the medulla. Approximately 20% noradrenaline, norepinephrine, and 80% adrenaline, epinephrine are secreted here. All these hormones are secreted in the adrenal medulla. Adrenal medulla is driven by the sympathetic nervous system and via ganglionic fibers originating in the thoracic spinal cord from vertebrae T5 to T11. Because of the inverted interrated and preganglionic nerve fibers, the adrenal medulla can be considered as a specialized sympathetic ganglion, like sympathetic ganglia. However, adrenal medulla lacks the distinct duct and releases the secretions directly to the blood. So that's why it's called an endocrine gland. Blood supply to the adrenal gland the adrenal glands have greatest blood supply. The rates per gram per tissue of any organ. So this is the more vascular, most blood supplied organ when you compare the grams of tissues and the number of blood vessels. Up to 60 small artery branches of the suprarenal artery may enter each gland. Venous blood is drained from the gland by suprarenal veins, one from each gland. There are several types of adrenal gland disorders which with its own symptoms and treatment. Adrenal gland tumors. Most adrenal gland tumors, abnormal growths on the adrenal gland, are not always cancerous. Adrenal cortical carcinoma can be cancerous. Cushing's syndrome, congenital adrenal hyperplasia. So these are the adrenal tumors.
బజ్జీ ఇప్పుడే
What are
వచ్చింది
the symptoms
బాగుంది
of adrenal gland disorders? Upper body obesity. So upper body
కానీ వాడు
obesity
మొత్తంగా వేసాడు మొత్తంగా 99,000
round face and neck and thin
99,000.
arms and legs. Skin problems.
మొత్తం టోటల్ నీ పెన్షన్ నీ ఎరియర్స్ అన్నీ కలిపి
The abdomen and the
97,000 వేసాడు దాంట్లో బైవర్కేట్ చేయాలి నా ఎరియర్స్ ఎంత వచ్చింది పెన్షన్ ఎంత వచ్చింది
Moodiness will be there, irritability or depression. High blood sugars, slow growth.
మొత్తంగా అలా వేసాడు అది అది వచ్చిన
What
తర్వాత
happens
చెప్తాను నీకు
when
రాత్రికి
the
చెప్పాల్సి
adrenal gland is not functioning properly, and the adrenal gland insufficiency and inability to increase the cortisol production, with stress can lead to Edison's crisis, Edisonian crisis. Edisonian crisis is a life-threatening situation as that results in low blood pressure, low level sugars, sugar levels, high blood levels of potassium. So potassium may be high, sugars may be low, and you may immediately need medical care. But this is a Edisonian crisis. It's called there is insufficiency of the adrenal functioning. What happens, what causes adrenal gland problems? Adrenal gland disorders are caused by problems with one or both adrenal gland or by the problems with the both with other glands such as pituitary glands. So pituitary gland problem also can show adrenal problems. Specific disorders can develop when the adrenal gland produces too few or too many hormones. So if they produce very less or very much hormones, also there is a problem. So when there is too many hormones are introduced from the outside sources, when there is commands coming from the pituitary which is wrong, then adrenal gland can be misled and it will be made to produce different types of unwanted hormones or the unwanted quantities of hormones. So now we will talk about homeopathic treatment for Addison's disease. Phosphoric acid is one of the best ones. It is, will be suitable for patients presenting with extreme physical exhaustion. They are tired, they have inertia, apathy, sexual weaknesses. These people are often complain about loss of hair, even change in visual acuity. They whole pathology arises from hypofunctioning, underfunctioning of endocrine system, particularly the adrenals. Calcemia. Patients will present with slow pulse rate, tired feeling, mental apathy. Usually there will be muscular weakness, drowsiness, and even dizziness. They are sensitive to falling barometric pressure. The blood pressure falls down quickly, with many symptoms aggravated by cold, damp weather, etc. They are lethargic, dull, and apathic to their own complaints. They feel sympathetic to self. They want to be left alone because any excitement, even good news, will make them feel worse physically. So they don't like anybody to come and sympathize with them. Calliphosphoricum, the personality is nervous, oversensitive, and excitable. Everything is too much for them, and when they get tired and get irritable. They have a feeling of that something bad will happen to them. They startle easily. They get surprised easily. They have a difficulty in concentrating, and they are forgetful of words and names. There is a profound state of mental and physical exhaustion. For them, Calliphos will work. Calliphos is a good medicine for general alertness and improving your general mental health. So next is adrenal fatigue. Adrenal fatigue is a symptom of adrenal dysfunction. Adrenal crisis can be fatal, can be very serious. It will be fatal. Morning and evening fatigue will be there, allergies will be there, apathy, increased susceptibility to infection, insomnia, poor recovery from exercise, chemical sensitivity, depressed mood, unstable blood sugar. Unstable blood sugar will be fluctuating, and they will have low sex drive. So this is the adrenal fatigue. So homeopathic remedies are argentum nitricum. This helps weak and trembling patients. Occasionally weakness will be there, and on one day they will feel well, and again weakness will fall again. They will feel weak again. This weakness can occur at times of regular intervals. They will be irritable, suffering with tremendous anxiety. They will start crying as they feel they cannot be helped. This state of debility is due to adrenal insufficiency. So arginine nitricum is for such people who are very weak and trembling with adrenal issues. Berberis vulgaris is useful for adrenal fatigue that is accompanied by chronic yet moving pains. So it also is beneficial for those who suffer from spinal irritations, irregular and regular manipulative treatment for misalignment of joints. So for them, Berberis vulgaris will work. Coffea cruda is useful when one suffers from tremendous nervous agitations, some restlessness. One experiences unusual activity of one's mind as well as body. feeling of each comprehension, irritability, excited and senses are acute. Uh, the patient tosses in anguish in sleep until 3 a.m. One also attend to wake up by at a start. Wake up with a start. Suddenly they will wake up and like that. Such sort of a disturbed sleep will be there. Sleep will be disturbed by dreams. One experiences sleeplessness due to mental activity, suffers from nervous excitability, and gets irritated by an itching anus also. Then gelsemium is useful for those who suffer from slow pulse, the tired feeling, as well as mental apathy. Uh, Usually, one does not experience muscular weakness and drowsiness when even dizziness. One experiences sensitivity to falling the barometric pressure. The blood pressure comes down. Damp weather also aggravates certain symptoms and feel lethargic and dull. Graphitis is unable to decide. One does not feel like working. One fidgets about while sitting and while working, and it can be used for skin affections and constipation. Fat, chilly, and delayed menstrual history and suffers from cold. It helps in the treatment of sexual disability. Ignitia, useful for one who is stressed, anxious, and overwhelmed, and has a changeable mood, introspective, and is silent brooding. It helps if one is melancholic and sad and tearful and not communicative. So he's a brooding person with some sort of stress or loss or grief. This ignitia will be used normally. That works well. Yeah. Calicarbus for nervous, oversensitive, excitable patients. They are tired and they get tired when they are irritable. They suffer from feelings that something bad will happen to them. They face concentration problems and forget words and names. There's a profound state of mental and physical exhaustion for them. So Calicam. Natmer, this helps to be the slow acting remedy and the best made for the chronic fatigue conditions. This remedy helps in preparing one's body to be able to effectively use salt and once relieves daily uses. Uh, that one, like when the whatever salt is used, it is being received, which is received daily, it will be managed by Naxomica. It can be helpful for people who suffer from low cortisol in the morning and at night time. They are wide awake and not tired at all. This makes it difficult for them to go to bed early, like one is supposed to do for adrenal fatigue. Naxomica can also help in bringing down cortisols to allow you to fall asleep quickly. So Naxomica is a good medicine. Phosphoric acid is suitable for a person who is present with extremely physical exhaustion, inertia, then apathy, as well as weak sexual feeling. These people do suffer from hair loss and even change of visual acuity. Ribes nigra stimulates adrenal cortex and adrenal glands, anti-inflammatory it is, and is useful for asthma, allergies, chronic fatigue, hypoadrenalism, and autoimmune diseases. And sepia is beneficial for people who feel totally burnt out and exhausted from the care of loved ones. Chronically tired, too much to do. It's especially helpful for mothers after childbirth. The exhaustion is both physical as well as emotional levels. It happens to be common remedy for busy moms with children as well as they are busy with work and have no time for themselves. So sepia is a person like that. So one can get use of it by reduced sexual desire will be there, no interest at all will be there, and it also is useful for menstrual issues that does include backache prior to menses, PMS, irritability as well as menstrual cramps. One is different to the loved ones as also the desires to leave one's family and go away but may not actually do it when one feels so. So there is a totally melancholic conditions in the sepia patient, and that is already mentioned here. So that's all with adrenal gland, and we're stopping here. Thank you. Murthy sir.
Okay, sir.
Yeah.
Is my voice audible?
Yes, sir. We can hear.
Thank you very much, Anup sir.
Okay.
Very excellent topic you have taken now. Actually, our homeopathy doctors should not venture in this type of addictions disease, because as supplementary to allopathic we can give.
Okay.
Because with little knowledge, whatever in the classroom we are telling, that with a little knowledge we should not ask the patient to stop the allopathic medicines. They'll let them continue with allopathic medicines, and ask them, our homeopathy will support that one and reduce the quantity of medicines what they are taking in future. It's very tough subject actually. Actually, we are having one excellent remedy in homeopathy, that you have to take daily 1 dose or 2 doses in 1x or 2x. Adrenalism, adrenalium, ADRENALINUM, adrenalum. That is 1x and 2x. It is available. This we can give. It is actually addiction disease means a lack of adrenal gland does not produce enough hormones. By that way, the person will become tremors. He cannot stand, and he cannot stand erect, right. Even if he sits also, the face, the neck will turn in this way or that way. He will bend this way or that way. The neck also cannot be stiff enough to stick on that body, like that. And tremors will be there, shivering will be there, and he will get too much of darkness whenever he is going out. So much of weakness will be there. For that, our Anup sir has told acids fast, one of the best remedy. Along with that, China you can take. And sometimes when neck problem is more, unable to lift the head, at that time picric acid also will work actually, because neck will this way or that way fallen. At that time picric acid also will work. Acid fast along with China, one of the best remedy for the tremors, including gelsemia. These three will work as a excellent remedies for weakness and fatigue of addiction disease. And another one is Berberis vulgaris. We should not forget that one. That is one of the main remedy, because it will protect the kidney functioning. Though adrenal gland is not sufficiently producing sufficient hormone, even Berberis vulgaris, sometimes if you want hydrangea also, if pain or anything is there, then hydrangea also we can use. Otherwise, Berberis vulgaris is one of the best remedy for this. Another thing, natrum mur, tension and heat in the renal region. Suppose if you keep the sides of the low back area, it seems that heat will be there. If the heat is there and tension, continuous tension is there, and getting some sweating also, he is afraid of that. Those things means natrum mur and califas, both put together if you give, excellently it will work. Another thing, he has given China sepia. Sepia is one of the best remedy. After 40 to 43 years, generally we have to give ladies sepia, because of their mental tortures in the family front and official front at the middle age, that is before menopausal time. Their symptoms will vary this way, that way. At that time, adrenal gland will be suffers. This is one of the symptom, mental symptoms. At that time, sepia frequently if you give, this will be reduced. And ferrum, preferably ferrum iode is one of the good remedy for maximum what we call debility. He is unable to walk. He will sit in one area or sleep flatly, lay down on the bed. In that time, you can give this ferrum iode. It will work excellently. Whenever he is standing, whenever he is talking, he will get more vertigo. At that time also ferrum iode will work. But when ferrum iode we are giving means China and califas also we have to give. Mind. Another thing, one more point is, we have to add alfalfa mother tincture and Avena sativa, both in mother tinctures. 5 drops or 8 drops both put together twice daily after food we have to give to make them to general health. Actually this is sufficient I think for Addison's disease, and whatever Anup Kumar has given the very vivid description, but this thing if anybody wants to treat means thoroughly study whatever Anup Kumar has today told. Thorough knowledge he has given fully, because you cannot get all these things in the books. Only in magazines we can get. Whatever I told, whatever I remembered through magazines also I told today. But one of the best subject what he has taken, adrenal gland, preferably Addison disease. Thank you very much, sir. Suresh Kumar, sir, you can take.
Hello.
Are you ready?
Is audio clear?
You are okay.
Okay. So, very warm good evening to all group members. Today we will look into the organs and other chapter. Small topics, very small topics. We'll look into it. First, we'll look into routes of channel of our administration of remedies. Routes or channel for administration of remedies. This is section 288 to section 292. I mean aphorism 288 to 292 of the 5th edition, and aphorism 284 and 285 of the 6th edition. These are the aphorism number where this particular subject has been dealt with. The subject dealing with the route or channel of administration of drugs is termed as pharmaconomy. The effects of the homeopathic medicine increases when they are dissolved in neutral liquid form and administered. This is because the medicine in the liquid form comes in contact with the more sentient nerves, resulting into early onset of the medicinal action. The best way of administration of homeopathic medicine is by mouth. For the treatment of both acute as well as chronic diseases, this safest yet effective method can be employed. So section 288 to 292 talks about the routes of the administration of this according to the 5th edition of the Organ of Medicine. According to 5th edition of the organ, it says that almost every part of the body that possesses the sense of touch is capable of receiving the medicinal effect and has a capacity to transfer the medicinal effects to various other parts of the body. So this is how the section 289 says that every part of the body, sentient part of the body, is capable of receiving the medicinal effect and transferring to other part of the body. Then coming to other aspect of this section 289, a patient even destitute of the sense of smell may expect an equally perfect action and cure from the medicine by olfaction. So here the term olfaction is also being used by the Dr. Hahnemann. So the another way of administration of remedy is also being quoted here as olfaction. Then the most effective routes for the administration of the medicines are, number one is tongue. Tongue is the most effective part, we can say, and the next, the mouth is another part through which we can administer. Then the stomach, then interior of the nose for olfaction and inhalation process, then rectum, then genitals, then skin, and wounded or ulcerated parts also. This has been highlighted in section 290. So the most effective routes, these are the routes through which effectively the medicines can be administered, as there is tongue, mouth, then stomach, then interior of the nose, then rectum, then genitals, then skins, and wounded or ulcerated parts also. Here in section 291, aphorism 291, it says that even those parts that have lost their function, examining tongue and the palate, that have lost their functions of the taste, can communicate the medicinal action to the other parts of the body. So this is the aphorism 291 also guides us that even the functions are lost, then the tongue and palate can communicate to the other part of the body for transfer of the medicinal action. Even the skin, then again aphorism 292, even the skin and the external surface of the body is susceptible of the powers of the medicine, especially those of liquid form, but of most sensitive parts are also the most susceptible to those. So surface of the body is also susceptible to the powers of the medicines, that is being highlighted in aphorism 292. So these are the various routes being given through organ for administration of the medicine. First, oral route. The homeopathic medicines are usually administered orally or singly. Orally and singly. The medicine given orally seems to be more effective and more prompt. So this is more effective way of method of administration because they act very effectively as well as promptly. The next is olfaction. Olfaction means smelling. Through smell, the medicinal powers can be transmitted. It is a method of administration of medicine to a patient through the nose and mouth by act of smelling. Dr. Hahnemann administered medicines by oral route for many years, but in his last few years, he favored also the olfactory route also. In the footnote given in the aphorism 288, Hahnemann states that homeopathic remedies act most surely and most powerfully when the medicinal aura that is always emanating from the medicine is inhaled for a short time. So here, the Dr. Hahnemann in footnote of aphorism 288, he emphasizes and gives also a confirmation that olfaction method is very effective, and because the medicinal aura emanating from it can be inhaled and cure can be brought in. So this is another confirmation which has been made by Dr. Hahnemann. Then method of olfaction, how it is done. For this globules or a single globules also can be taken. The globules moistened with the medicinal fluid are placed in a small phial, and homeopathic physician allows the patient to hold the open mouth of the phial first in the first one nostril and in the act of inspiration. So the phial, the globules dipped in the medicinal substances is kept in the dry phial, and this phial is held in front of the first one of the nostrils, and in the act of inspiration, the patient draws out air into the himself. Then, if it is wished to give a stronger dose, the patient can be asked to inhale the same vapor from the other nostrils also, more or less strongly according to the strength as intended. So here the nostrils, through inspiration of the air, the medicinal aura is inhaled and it reaches the organism. If also Dr. Hahnemann further gives suggestion or advice that if both the nostrils are stopped by coryza or polyps, like that, the patient can inhale by the mouth, holding the orifice of the file between the lips. And in case of the little children, it may be applied close to the nostril while they are asleep, with the certainty of producing an effect. The medicinal aura thus inhaled comes in contact with the nerves of the walls of the spacious cavity and thus produces influence on the vital force in the midst yet most powerful manner. So he says that in case of nostrils are blocked on account of the polyp, on account of the acute coryza, then the medicinal substance can be inhaled. The aura of the medicinal substance can be inhaled through mouth also. And in case of children, we can bring the phial of medicines near the nostrils of the children while they are asleep. So these are also methods or techniques being prescribed or detailed by the Dr. Hahnemann in aphorism 288 and 289. So olfaction is also a valid communicable route for transmission of the medicinal action into the body. So the next is by application on the skin. So the first I told oral route, the second is olfaction, and the third is application on the skin externally. So here through rubbing or friction, the process is application of the medicine on the surface of skin through rubbing or friction. The friction through the whole cutaneous surface of the body, wherever the epidermis is found sound, wherever the epidermis is found very sound, intact, such as inner parts of the thighs, lower parts of the abdomen, back, arms, legs, then testicles, labia majora. These are the external surfaces where we can think of applying external. So through the act of friction. So in the section 292, he says that by rubbing, it appears to favor the action of medicine only in this way. Friction makes the skin more sensitive and the living fibers thereby more capable of feeling, as it were, the medicinal power and communicating to the whole organism this health effect, affecting the sensation. So he advises that we can apply the medicine externally on the external surface of the epidermis, so that the medicinal substance can reach the inner parts of the organism. So examples can be given like we apply lotions, ointments, liniments over the unbroken skins. So this is another possible route or the method through which the medicine can be administered. So first I said oral route, the second olfaction, and third is rubbing or applying on the external surface of the skin. So on the epidermal layer we can spread the medicine. So this is about the what he has told in fifth organ. But in sixth organ, in the aphorism 284 and 85, the views of the Hahnemann on the routes of administrative medicine have little changed over the period of time, and in the sixth organ, he accordingly he quotes that the most commonly affected parts can receive the transfer of the medicinal action in a better way through tongue, mouth, and stomach, and the nose by olfaction and inhalation. So he again repeats or confirms in sixth organ that the route for administration can be tongue, can be mouth, can be stomach, and nose as through respiratory organ, and the skin, the epidermis also can take the effects of the medicine in a better way if the same medicine is also administered internally. So here in section 284 of the aphorism 284, he quotes that skin also can take the effect of the medicine provided the same medicine is also administered internally for a both better way and efficacious way of bringing the cure. So here in aphorism 284 and 285, he limits the application to the tongue, mouth, stomach, nose, that is respiratory tract, then skin, then epidermis. So further in footnote in aphorism 284, Hahnemann says that the power of the medicines acting upon the infant through the milk of the mother and wet or wet nurse is very helpful. Every disease in children yield to the rightly chosen homeopathic medicine given in moderate doses to the nursing mother. So here he also quotes about the if the infant is given medicine is given through mother's milk, that is also the another possible route through which the children can be administered medicine. In this context, Father Hahnemann suggests that if we administer antisoric remedies with highly potentized dose of sulfur to the mother in order to free the newborn from the adverse effect of the sora. So he also quotes another possibility that if the mother is given the antisoric remedy in a higher dosage, then it can reach to the child also. So this is another tips given by Dr. Hahnemann in footnote in section 284 for the administration of the medicine to the baby or the infants. So this is also very valid route for administration of medicine for infants through milk of the mother. So this is the another route by which Dr. Hahnemann suggests us for administration of medicine. The cure of the very old disease may be further by physical application, extending the back, arms, and extremities by rubbing the same medicine is given which is internally and which shows itself curatively. In doing so, one must avoid parts subject to pain, spasm, and skin eruptions. So further in this section 284 and 285 of the sixth organ, he says that physical application of the medicine can be advised or can be possible on arms, extremities, etc. when the same medicine is internally also given. But we have to see that part, we must avoid any pain or spasm or any skin eruption advent on the external application. So this we have to keep in mind when while administration of the medicine on the external skin route. So here he says that please keep a track of the pain, spasm, or the skin eruptions, if any, on the skin surface. So here we have to be cautious when we are applying medicine through epidermis. So this is all about the section 284-85 in the sixth organ, as well as the section 288 and 292 of fifth organ. That is, the roots of the medicine administration has been given through our organ. So this is what very important chapter, which I have covered very briefly on this. So once again repeat that administration can be through mouth, can be tongue, can be stomach, and can be respiratory at olfaction. It can be skin also. So these are the possible channel, the routes through which we can effectively administer the medicine for bringing a cure. So this is all about routes of administration of the remedy. Then coming to another small topic, which I would like to talk about this also now itself. The other is aphorism 91 and footnote of section 96 in the 5th edition, as well as aphorism 281 of the 6th edition, where it has been talked about the term placebo. Placebo is a new term, which is quoted in aphorism 91, aphorism 96, and aphorism 281 of the 6th edition. So let's see what is placebo, when it is used, what are the various administration mode, and when it can be applied, and all the things have been, let's see one by one. This word placebo. Placebo, the term placebo is derived from Latin word placer, which means to please or satisfy. The Latin meaning of this is to please or satisfy. When the physician does not like to administer any homeopathic medicine to his patient, or in other words, when there is no necessity for administering any medicine, he gives some unmedicated substance to satisfy the patient and to create confidence that he has been using through the medicine regularly. This unmedicated substance is known or called as placebo. I repeat, when the physician does not want to administer any homeopathic medicine to his patients, or otherwise, when there is no necessity for administering any medicine, then in such circumstances, when any physician prescribes or gives unmedicated substances, this unmedicated substance is known as placebo. Or the other synonym for this placebo is known as nihilium, phytum, rubrum, and lactopen. These are the terms used for the synonyms for placebo. But the common term which we use in our practice is placebo. So any unmedicated substance when given to a patient during the process of treatment, okay, that is known as placebo. Then different forms of placebo. What are the different forms of placebo? Solid substances. Let's see solid substances. Sugar of milk, empty sugar of milk, globules, tablets. The tablets are otherwise known as biscuits also nowadays. Then cones. There are cones also in solid substances. So these are the various placebos: sugar of milk, globules, tablets, and cones. These are the solid placebos. Then in liquid substances, alcohol, purified water, or rather distilled water, purified water with alcohol, mixed with alcohol. So these can be also placebo. So these are the different type of placebo which has been used by masters, homeopathic masters. I repeat, solids like sugar of milk, globules, tablets, cones. Then in liquids, alcohols, distilled water or the purified water, and purified water mixed with alcohol. These are all the vehicles used as a placebo. Now, let's see Hahnemann's view for placebo. The section 91, fifth edition of the organ says, when the disease is of chronic in character and the patient has taken medicine up to the time he is seen, the physician may with the advantage leave him for some days quite without medicine, or in a meantime that he may administer something of unmedicated nature. So what happens in case of chronic conditions? The physician gives a single dose of medicine, and with the application of single dose of medicine, he want to wait and see the reaction. And in such circumstances, he doesn't want to prescribe further any remedy with the prescription of a single dose. Then in such scenario, the physician may like to administer the substances which are unmedicated in nature. Then in the footnote of section 96, fifth edition of the organ, a pure fabrication of symptoms and sufferings will never be met with an hypochondriacs. Even in the most impatient of them, a comparison of the sufferings they complain of at various times when the physician gives them nothing at all or something quite unmedicated. So this is also quoted in as a footnote in section 96. Then in section 281, aphorism 281, sixth edition of the organ, it says, in order to be convinced of this, the patient is left without any medicine for 8 or 10 to 15 days, meanwhile giving him only some powders of sugar of milk. So these are the various aphorism section, aphorism 91, 96 and 281, which tells you about the applications of the placebo by the masters. And Hahnemann himself has advocated that use of unmedicated nature of substances when we would like to wait and see and watch after administration of a single dose of remedies in a chronic state or chronic condition. So the placebo is once again say, is an unmedicated, non-medicated substance. Then comments of the stalwarts regarding placebo. First, I will take comments of the Dr. Stuart Close. Placebo is the second best remedy without which no good homeopath could have long practice of medicine. The use of placebo is simply the one form and is a very powerful form of therapeutic suggestion, or to use a still more in recent time as a psychotherapy. So here Dr. Stuart Close has advised to use placebo in our practice as a psychotherapy. Then Dr. Kent, the famous pioneer of homeopathy, say that if you do not prescribe unless you find the remedy, instead prescribe placebo. Now there is another situation where one is unable to find a suitable remedy, appropriate remedy, rather simillimum remedy. Then you need some time, some moment for your self-assessment, judgment, or coming to conclusion. Then during that period, definitely we can think of prescribing some placebo for the patient as also psychotherapy. So here also Kent also suggests use of placebo when you are unable to find the appropriate remedy. So Dr. Stuart Close and Kent, both of them advised for use of placebo. Then utility of placebo. Let's one by one utility of placebo we'll see. Both in acute and chronic diseases, when a well-selected medicine continues its action either in centesimal scale or either in the decimal scale, we should not disturb the case. During this period, we had to give the placebo to keep the action of medicine undisturbed. At the same time, patient also knows that he is taking medicine, the psychological effect. So that this is circumstances when we don't want to interrupt the medicinal action once given, one dose given to him, and we don't want to change the action of the medicine. So in such scenario, we can, as a psychological effect to the patient, we can give the placebo here. Then most of the medicines start their action without homeopathic aggravation. Most of the medicines, they start their action with homeopathic aggravation. That is as per the Kent's third observation. Okay, so wherever the homeopathic aggravation occurs. So during this aggravation period, the patient assesses the doctor, and being in a bit of perturbed due to aggravation. Sometimes this aggravation is so severe that even the doctor becomes perplexed. But any experienced physician can easily differentiate it from the other type of aggravation, medicinal aggravation and disease aggravation. In these circumstances, no medicine should be administered to the patient, but for the satisfaction of the patient, we should give placebo because the type of aggravation subsides within few hours of the administration of the medicine. So here again, the second circumstances is being quoted, that wherever the homeopathic aggravation occurs, and because of homeopathic the physician must be very sharp enough to identify between the homeopathic aggravation and that's called disease aggravation. So whenever the homeopathic aggravation occurs, so the physician doesn't want to interrupt in between. So you want to wait and see the action of the medicine. So in such cases, to keep the patient satisfied, because the patient will be perplexed, very perturbed, in such scenario, to give him a consolation, or say to give him the psychological way of attempt of treatment, here we can use placebo, and we give this placebo impact here. So in case of homeopathic aggravation, it is been advised to give the placebo. Then third, immunity. When patient comes to us after being overdrugged from allopathic or homeopathic system, generally it is found that the case does not give very clear indication for selection of the similimum. Here we should prescribe placebo at least for 2 weeks. In the meantime, the vital force can annihilate the medicinal symptoms due to the overdrugging, and we will get the true picture of the disease. So this is the another circumstances which is being quoted here. Then when the patient comes after the overdrugging through allopathic or any homeopathic system, and there is the disease picture is very confused, and we are unable to arrive at similimum, then we can give placebo for 2 weeks, so that the situation changes, circumstances changes, and this the overdrugging impact is being withdrawn, and the vital force conflict is truly visible externally, and then we will get the true picture of the disease. So in such circumstances, placebo impact is advised, or placebo is can be used. Then in homeopathy, we give minimum quantity of medicines to a patient. So we give 2 or 3 dosage to any patient and ask him to come after a long time, especially in chronic disease. The patient will not be very happy. So number of placebos dose is given along with the indicated medicine, so that patient will think that he is taking medicine regularly. So here also another tips is given in case of chronic conditions, where only we need to prescribe some constitutional remedies, 1 or 2 dosage, or at the most 3 dosage. Then the patient will not be satisfied with 1 or 2 doses or 3 doses of medicine. So keep the patient very happy. We can support with placebo intermittently so that the patient think that he is taking medicine regularly. This is the psychological impact given in case of a chronic disease state. Then the another situation is indisposition is a condition which never requires a medicine. The intelligent advice on the diet and regimen of the patient with the proper use of placebo always proves beneficial than use of medicine. So sometimes is here also we have seen a chapter earlier about the indisposition. Indisposition is a small alteration in the our organism which restore back over a period of time through appropriate discipline of the diet and regimen or proper diet regimen. In such scenario also we can think of using placebo because there we don't want to give any medicine, rather we will give placebo so that this slight deviation or the slight indisposition can be restored back to the health. So in case of indisposition also we are allowed to use placebo. Then Hahnemann advises us to start a chronic case with usage of placebo also. It helps in identifying patients who exaggerate their complaints, particularly hypochondriac in nature, also helps with overcoming the previous prescription and also helps in accessing the patient's susceptibility also. So Hahnemann also advises the physician, in case of chronic cases, you can always start using the placebo at the earliest stages because in early stages, patients may give you exaggerated view of their complaints because of hypochondriac nature. So here also he advises, Hahnemann advises to use the placebo instead of prescribing the remedy immediately. So it gives more, next, the conclusive utility. It gives more time to physician to study the case and select a medicine that will keep his honor. By the method of a placebo, the physician also gets the adequate time in the study of the case and selecting the medicine. So these are the various utilities which has been given in our organon about the use of placebo in our practice. So I have given the utility of a placebo, or that is called empty pills or empty liquids or unmedicated substances. When we can use the unmedicated substances and their need and necessity. So these all I have given input about the placebo. So with this, the aphorism 281 of 6th organon, 6th edition of the organon is also being covered. So today I have given talked about the various medicinal administration routes and about the impact of the placebo in our clinical practices. So about this I have given the sufficient inputs. So with this I give pause to my talk here. Over to Dr. Anup.
Thank you, Suresh sir. Let me see Moti sir if he's there. Moti sir? Yeah, Moti sir would
What did
not.
I left?
Yeah, he would have left anyway. If there is any questions, we'll take. Otherwise, we will call it off.
Sir, I
Any
have
questions?
one doubt. Sir, shall
Go
I
ahead.
ask?
Yeah, go ahead. Go ahead.
Yeah, Suresh sir is telling about that nasal, through nasal also we will give sometimes medicines and all, no? So, if you select 3 to 4 medicines for one patient, if internal, we will give one medicine. We should wait for according the duration, the time of the medicine. Okay. So yeah, other selected 2 medicines shall we give it to through nasal?
No. Madam,
Ah.
always it is being recommended always that only one medicine is administered at a time. Okay.
Yes.
no
Okay.
polypharmacy. Let's keep it in our mind. No polypharmacy is permitted in our homeopathy. First, we have to keep always in mind that let's go with always single remedy. No or three remedies together. Only these are in organon. The masters have advised the root variously, but olfaction method, the nasal root is always very rarely very used. Okay, very rarely used. Predominantly these days, very commonly we use only the only when the person is unable to take the oral route medication process, then we can think of through oral route, particularly when the person is in coma like state. When oral route cannot be administered, then we can think of using inhalation process or olfaction process. Otherwise, it may lead some trouble to all of us. So better it is in common practice. Let's not, though our organ gives the input route as olfaction nasal tract, but it is not advisable by us because sometimes as a layman, as a unexperienced hand, we may put into some trouble. So let's be limited to only oral route. Let's be limited to oral route through tongue only. And further, at a time, let's be with only single remedicine, not using polypharmacy. Very extreme circumstances, very extreme circumstances, we can go for polypharmacy, one or two or three remedies. Better, I will advise not to go for olfaction uh, because it involves some risk and some dangers also. Because sometimes it may also choke the nasal tract also. So let's not invite any danger or risk. So let's not go for that such type of practice which are not being used these days. So the most common way of using the medicine is oral route, the tongue, mouth. That is the common way of administration of drug. I have only given the medicine different route as per organon only, which masters have suggested in extreme situation or extreme conditions. Okay.
Okay, sir. Okay, sir. Thank you, sir. Thank you.
One more thing is, see, we choose medicines that follow well.
Yeah.
The combination, we choose the medicines that follow well. The another aspect is, the medicine that once given, the next medicine that is recommended or given may antidote the earlier medicine. That's quite possible. For example, if you see in the Crataegus heart tonic, camphora is added.
Yeah.
The characteristic of camphora will antidote all other medicine. All other medicine. Then how it will work? How this homeopathic drugs are prepared from 3 to 4 medicines given in a tincture form works. The answer is they take precautious methods in antidoting effects of the medicine before combination is given. That's how we are safe. The same way, sulfur lycopodium china, calcareca lycopodium china. Again, sir.
CLS, sir.
Sulfur, lycopodium and calcareca. They should be given in this order. Sulfur, lycopodium and calcareca. If the things are given in a reverse order, they'll have immense effect on the body, reaction. some will say, if you give calcareous cord in the beginning, it may cause immense disturbance because it's a constitutional remedy. It gives lot of disturbances. So patient may not be able to withstand this disturbance because he is coming to the homeopathic mode. All these things are there. That is why we manage them. In the first time, we give them the palliative medicine, then make them normal, then go to the combination or go to the medicine without. But as far as the combinative drugs are concerned, they will act only for a specific. So, whether the medicine will be helping or medicine will be antidoting is only for a minimal period, because you are going to repeat the dose. Again, it will have a curative therapy. Second dose, third dose. That's why we are advised to take in a chronic heart disease cases. You are advised to take this tonicard 2 times a day, 3 times a day, 10 drops or 20 drops as the case. Yes, definitely in this combination, when the medicines are there, they will act for some time and they will stop acting for some time. That's why this repetition is good. I think Madam has got clear. Doubt is clear, I think.
Yeah, yes, sir. Yes, sir. Thank you. Thank you very much, sir.
Any more doubts?
And just I want to substantiate
Yeah.
Dr. Surendra's what he has told, that when we look into our homeopathic Materia Medica, when we read drugs, at the end of every drug, there is a complementary remedies are being given, supplementary remedies are given, then antidotal remedies are given. So why this we have to think always. And so when Dr. Surendra has been now narrating, then whenever we use multiple remedies, then we should have a thorough knowledge of the complementary remedies, supplementary remedies, antidotal remedies. These have got a very great relevance in prescription and practice. So we must have a very thorough knowledge of how, when we use 2 or 3 medicine, in what way it will not interrupt the cure process, the recovery process. So in a judicious way, we have to use this 2 or 3 remedies. When we are in combined way, we are in combined way we are giving to medicine. So that's why, unless the physician is very, very intelligent, equipped with expertise and experience, so let's avoid going for polypharmacy, rather adhere to what's called single remedy. So I'm substantiating Dr. Surendra's what he has told, that as far as possible we have to confine ourselves in a single remedy, so that we don't bring any risk. And what's called one other is, we also will be, as a physician, we also will put into a lot of troubles in prescription, second prescription. First prescription is very easy, but second prescription will be very tough when it's complicated, right? So let's avoid polypharmacy or multiple prescription together. Okay, over to Dr. Anand.
Yeah, if there is no other questions, we can wind it up for today. Surendra sir?
Yes, we can wind up.
Okay, so thank you all. Thank you very much for attending the classes today. So we'll meet up next week. Thank you all.
Thank you.
Thank you, sir. Thank you. Thank you.
Well,
Thank you all, sir. Thank you so much.
Thank you.